So good afternoon, everyone. I've disabled the waiting room, so I'm going to let people continue to join us, but I will go ahead and start my remarks off. Thank you so much for joining us this afternoon for this Home Visiting Coordination Initiative HVCI webinar. We are so pleased to be joined today by Kate Breslin, President and CEO of Schuyler Center for Analysis and Advocacy. And she's going to be joining us and talking to us today about the social determinants of health and home visiting. My name is Maggie Dixon. I am the Home Visiting Coordination Initiative Development Coordinator at Prevent Child Abuse New York, and I head up our webinar effort. So I'm just here to kind of share a couple housekeeping items before we dive in. As you just heard, this meeting is recorded and it will be posted on our website. Following today's session, I'll send a follow-up email to everybody that registered with a link to the website and kind of a little explanation of how to access the recording. Also in that follow-up email will be any supporting resources. In the email where you registered before today's session, Kate had shared a couple of resources that would be helpful to read before today's presentation, and I'll go ahead and drop those links in the chat after I finish up. But we'll put any supporting materials in the follow-up email as well. This session is closed captioned. There are closed captioning services. So if you go to the bottom of your screen and hover over the closed caption CC button, you should be able to see subtitles if you click show subtitle. And finally, the Home Visiting Coordination Initiative is a project funded by the Preschool Development Birth Through 5 grant. And a component of this grant is data collection. So in the follow-up email, I will be sending a link to a survey that we would so appreciate you filling out to provide feedback, and it's information that we can use to report back to the state and our partners. So without further ado, I'd like to thank Kate so much for this session, and I'm going to turn it over to you.
Thank you. Hi there, I'm Kate Breslin, and I'm President and CEO of the Schuyler Center for Analysis and Advocacy, and I'm very excited to be here today. I would really want to thank Prevent Child Abuse New York for pulling this together, and thank all of you for all the work that you do. I know some of you are people who are involved with home visiting programs and or otherwise support home visitors and home visiting. So I'm just delighted to be able to talk with you a little bit today. So the Schuyler Center for Analysis and Advocacy is a statewide, nonprofit, nonpartisan organization focused on shaping public policy with a particular focus on children and families living in poverty. And we are getting ready to celebrate our 150th anniversary, always with that same sort of focus on shaping public policy for people in need. And one thing that we've been involved with that even predates my time at the organization is maternal, infant, and early childhood home visiting. We are strong supporters of home visiting and of making sure that children and families have access to whatever they need to help kids be healthy and thrive. So we coordinate a home visiting work group that really focuses on the policy side of things. And so I'm just very happy to be talking with you today. So I think I will start by saying, it's complicated. Health is mostly determined by things other than medical care. And social determinants of health are mostly driven by political decisions. I think we all know this, but what I'm going to do as we talk today is talk about social determinants of health, what they are, to do some level setting. I imagine it's something that most of you have talked about and heard of, but just to sort of start the conversation with some level setting around social determinants of health, why they're hard to address, some current efforts that are happening in New York State to try and do better around the social determinants of health, and then close with a discussion of what I'll call the political determinants of health and things we can do there. So the social determinants of health are the economic and social conditions that influence the health of people and communities. shaped by the amount of money, power, and resources that people have, all of which are influenced by policy choices. Social determinants of health affect factors that are related to health outcomes. And the way I think of this definition is really, social determinants of health in many ways are everything that affects a person's health outside of and in addition to medical care. So I put up the picture of the flowers because, you know, if fertilizer is one thing that helps flowers grow, the social determinants of health are the air, the water, the soil, everything else in the environment. And it's widely understood that social determinants of health play a much larger role in people's health than medical care. But even though those social determinants of health influence health outcomes, for the most part, the way our medical system is structured, our medical system hasn't paid attention to social determinants of health, and there aren't incentives in place to, until more recently, to get them to. So examples of social determinants of health that you all probably are aware of and working on are how a person develops in the first few years of life, the education that a person gets, discrimination, including racism or homophobia, and the social support that people have to help with those. Being able to get and keep a job, what kind of work a person does, having healthy food, housing availability and status, and how much money a person earns. So as we did some work, our organization, together with the State Department of Health as they were implementing value-based payment, we sort of, this is a pretty typical schemata, but breaking out those categories as you start to think about what are the social determinants of health that an individual person or a family or even a community may be facing. You can start to break it out into these categories: economic stability, education, health and healthcare, social, family and community, neighborhood and environment, and then the subcategories underneath those. And those are you.
Can everyone hear me? It seems we may have lost Kate.
Yes, we can hear you.
Okay, I'm going to resume. So we're back now. Go ahead, Kate. I hope everyone, thank you everyone for your patience.
So, yeah, can you go down to the slide that has all the boxes on it? It's about 3 down. One more. Thanks. So we were just sort of, this is a useful way of looking at sort of where social determinants fit in as we start to think about what some of the interventions are. So this was part of, thinking about, okay, what are the social, starting with what are the social determinants and then starting to think about what are the interventions. So next slide. So there are some challenges associated though with trying to address those social determinants. So what interventions do we implement, what's needed, what's available, what's most effective, how do we track the success of different social determinants, how do we know that somebody is actually accessing whatever services we refer them to, and how do we close the loop to make sure that they are getting the services and that they're having an impact. Who develops and maintains and ensures the accuracy of a catalog of community services, and who pays to make sure that people are able to get the services that meet their needs. And so on the next slide, you can see sort of a diagram showing some of those challenges. Okay, so there's a family with children over here, and there are all these different ways of trying to get them to services, and then there are kind of like a whole bunch of different ways to try and a whole bunch of different places to go to try and get them there, but we don't always know who's where, what languages they serve, what the eligibility criteria are. So there are a whole bunch of barriers to making sure that can happen. So next slide. So community-based organizations are well positioned to address the social determinants, but as I said, there's a lot of confusion about where those services are located. There's not a clear directory often. Community-based organization services that might help with social determinants aren't evenly available in communities across the state or the nation. And at present, no organized system exists to connect people with identified social determinant needs to available resources in their own communities. There have been some private firms that have tried to fill those gaps. So, and different entities around the state have used some of these entities like Now POW, Unite Us, Healthify. And what they do is they develop directories that can help refer to community-based services, but their model, these entities, their model is, it's a profit-based model, so they're not open source. In some communities, 211 and or United Way or other assist with connections, and from what I understand, a lot of folks around New York State are using 211. In New York City, there is something called the Health Information Tool for Empowerment, HITE, which is an online directory, and it has information about health and social services in New York City, Long Island, and Westchester. And then I thought I'd also just highlight the Monroe County Integration Project, which is also multi-sector and trying to establish connections among and between local health, human services, and education providers. Just like with so many of the things we all work on, there are these crazy barriers between in many of our communities and services between what's health, what's human services, what's housing, when the reality is these are all just things that people need. So next slide. So I thought I'd talk a little bit about screening. Social determinant screening is happening more now than it was even just a few years ago. It's happening in many different settings. It's important to know, I think often, for a lot of us, we think, oh, wouldn't it be good if we could do screening? It's really important to keep in mind that screening for social needs, or really, screening for anything, without the capacity to offer or connect a person or family with assistance can cause significant mistrust and even be traumatizing for a family that's already really in tough shape. So I just want to call that out, because in some ways it's it's the easiest thing to do is to screen, and there are a lot of tools out there, but it's important to keep in mind that if we don't have the capacity to make those referrals. Screening is really risky. And screening tools for social determinants of health are limited, and especially for children, which if you're in home visiting, that's, you're working with children, families with children. There are states, many states that require Medicaid either plans or providers to screen for and or provide referrals for social needs. And there's not one tool. There are many, of course. So that makes the consistency of the information or data coming in a challenge. So it's hard, for example, so if we were to have a one tool, that would make some people happy and some people sad, because some people would say, well, I really think my tool gets at what I really need in order to serve a population that I'm working with. And at the same time, there are others who would say, if we had like one or at least some consistency around screening tools, we would be able to do better thinking kind of more comprehensively and do better planning for the needs in our communities. And then I'll share this slideshow, afterwards, but at the bottom, there's a link to a place at the New York State Department of Health that shows a list of and links to commonly used tools. And those tools try and get at the very things we talked about earlier, like housing, food security, and things like that. Okay, next slide. So I thought I'd talk a bit about some of the things that are happening in New York State that are trying to address and think about how do we do better systemically around the social determinants of health. So just a few years ago, New York State Medicaid, the Office of Health Insurance Programs, created a Bureau of Social Determinants of Health to really, which was a recognition of the importance of, let me just step back. I think people in public health have always recognized and understood the importance of the social determinants of health. However, people more on the health insurance side of things and the health care delivery side of things, which is what the Office of Health Insurance Programs is, were less engaged on social determinants of health. So this was a big step to see sort of our state's Medicaid, the medical payment agency, saying, oh, we recognize that if we start to do better with the social determinants of health, it'll help our our public's health, but it'll also help our Medicaid program. So that's kind of a big deal. And then there was also success because of, frankly, because of probably many of you on the phone and a large, coalition of folks who really worked hard to make sure that as New York State started in its Medicaid and health insurance programs to engage in value-based payment, to require that when a health insurance plan and a provider contract for value-based care, so they create a value-based contract, that there's a requirement if it's a certain type of agreement that they have to implement at least one social determinant of health intervention, and a requirement that they have to include at least one community-based organization. And I have to say, like, that might seem like a pretty small thing, but it was even getting there was kind of a big deal. I think about it in some ways like, we all go to the tools in our toolbox, and historically on the medical care side, the tools in the toolbox are pharmaceuticals, right? So on this side of things, on the kind of health insurance and Medicaid side of things, it's a really big deal that there's some attention to the social determinants of health. Next slide. And then our New York eHealth Collaborative, which is the entity that tries to help connect health information. So the New York eHealth Collaborative created the SHIN-NY, the Statewide Health Information Network, which is designed to allow the electronic exchange of clinical information and connect healthcare professionals statewide. So that means that if, for most of us, if you go to your primary care provider, ideally, they're able to access information from a lab that you've been to, or if, you know, the place where you've gotten your mammogram, and they share information. So the SHIN-NY is created to help connect healthcare providers with each other and with the data that they need to give people the best care that they can get. And so the regional hubs, which the shorthand for them are QEs, qualified entities, currently connect the data from all these different healthcare providers. And right now, the New York eHealth Collaborative is engaged really actively over the last couple of years in exploring how do we start to connect social determinants of health and CBO services into this existing health information exchange network. So there are a whole lot of issues and challenges, including, of course, like privacy, security, who has access to what data, and all that kind of stuff. But there are, it's important to know that there are efforts going on to try and figure that out. Next one, please. And then over on the maternal and child specific side, one of the initiatives that came out of the first 1,000 days on Medicaid, which is being called the Maternal Infant Care Initiative, is presently being implemented. And it's a way of connecting home visiting, social determinants of health, and this data stuff, trying to do better about making sure the connections get made and the referral loops get closed. So in this initiative, which is only it's just starting, it's only happening in a few communities around the state, but it's a laboratory. Well, it's trying to do better for moms and babies, and it's a laboratory for looking at how do we make some of these things work. So in each of these pilots, there's social determinants of health screening, and then there's assistance from a family navigator. There's linking to families to appropriate community-based mental health, well-being, or educational resources. And then up to 3 light touch home visits to identify to certain high-risk moms and babies. And then next one is still about this Maternal Infant Care Initiative, the MICI. And so what it's aiming to do is to solve some of these issues that I mentioned earlier. So improve access for high-risk populations to available resources in their communities, in part by working with using peer navigators, expanding universal light touch home visitation, and improving communication between community-based organizations and primary care providers. And so that being pediatricians and often OBGYNs and primary care, other primary care physicians. And so we all know that, you know, timely referral and follow-up and better integrated better integrated services that are inclusive of social and educational and health yield better outcomes. Okay, so that's sort of some of the what's happening with social determinants of health here in New York State, but I also really wanted to call out what I would like to call the political determinants of health. You know, we call these the social determinants of health. I have I had people emailing me saying, we should be calling them the social determinants of life. They're not just of health, you know, and it can't just be one of our systems. It can't just be health, or it can't just be, you know, children and family services, or, you know, we have to think of this sort of all comprehensively. So I agree, we certainly need, I guess I would say, a Copernican revolution. You know, we need to center the kids and the families, not sort of these different agencies and programs. But we also need to really think about what sort of the bigger picture. And I would argue, step back, and this is, I'm going to honestly say this is the reason for the work that Schuyler does. So on the next slide, the drivers of inequities, health inequities and outcome inequities in our society are political. So all of these social determinants of health, whether it's, you know, food access or discrimination or housing access, all of those social determinants are preceded by a political action or lack of action. And if we didn't already see it, COVID-19 laid bare that it is not a coincidence that certain groups of people in the US experience higher premature death rates or poorer health outcomes. Research shows that air pollution, climate change, you know, toxic waste, access to fresh food, housing, you know, whether it's insecure housing or unsafe housing or expensive housing, lack of transportation, all of those factors play a outsized role in determining our overall health and well-being. And systemic racism can affect physical and mental health. And the systemic racial inequities embedded in our systems have deep historical and political roots. And so, and another great example is segregation. So housing and segregation is associated with significant differences in neighborhood quality, living conditions, and access to opportunities. You know, the zip code where you were born, in fact, can have a big determinant factor, implication in your future. So to address those things, next slide, please. To address those things, we need to also, in addition to figuring out how do we get the humans who need things to the things that they need, we need to be doing the political stuff as well. And I'm saying political, not partisan. This isn't at all partisan, frankly. This is, we need to think about educating people about the implications of those political decisions. We need to work within our communities to help people understand it, explain the issues to other people that we work with, and ultimately seek policy change that'll address those things. And then I'll close with the last slide and invite folks to ask questions, or I don't know, I think it might be by chat. I'm not sure how people are going to ask questions or say anything. You don't have to just ask questions. Say anything you want.
I invite folks to pop questions in the chat. I don't know if you're able to see them, Kate, but
I can. Let me just get, like I said, I'm on somebody else's computer, but I can get there. Let's see. Oh, good. I'm glad to hear somebody's using 211 often. I'm not sure.
Thank you. Can we just say thank you on the microphone? Well informed. That wasn't an option, so I think I'm learning that I'm a risk taker. So I want to thank you for this knowledge, this awareness. So for me, I'm a new entrepreneur, and this is right up my alley. I'm in Brooklyn, New York, and this is my passion. So for me, if you can guide, what would be my next steps to make this happen in my local community.
What kind of entrepreneur are you?
Parent advocate in public education.
Right on. I think, you know, I'm so glad you asked that question. I think, you know, information is power. And so, you know, part of on the more like detailed and on the ground side, it's figuring out what it is that people in your community are asking for and what they need, you know, on the, whether it's in any of those buckets, you know, housing, food, or other things. And on the, I guess I would say the political side of things, I think, frankly, it's really making sure that people understand that these are structural problems, these are structural challenges, and drawing that line between, you know, the reason there's you know, why there's housing segregation, and what the implications of it are. So I'm, you know, that's just a start. And thank you for the question.
You're welcome, and thank you for the advice.
And on that note, we had another question about, you know, just getting politically involved. Are there committee meetings? You know, can you speak to opportunities that folks can, I mean, this webinar is just an opportunity to kind of partake in a conversation, but I'm wondering if you have any thoughts.
Yeah, I think, you know, so I'm thinking about, you know, what I've been thinking a lot about lately is, if you want to stop the bleeding, provide direct services, and we need people doing that. If you want to prevent the injury, change the policies. And so I think both and, so, you know, making sure that there are services in our communities and that there are connections across services in our communities. And at the same time, my urgent plea is to kind of engage. So I'll give one specific example. Schuyler Center has been working to get our policymakers to commit to cutting child poverty in half in 10 years. We know that a lack of access to resources, money, and a lack of ability to pay rent and get healthy food are directly connected to outcomes. They're directly connected to health outcomes and to child development. And so, you know, I would say there are things like, feel free to go to our website, look at, you know, there are letters to the governor saying you should sign the Child Poverty Reduction Act. And a big shout out to Prevent Child Abuse New York, who's involved in that fight with us. So, you know, those kinds of things for us, one of them is child poverty. We are working really hard on childcare for the same reasons on the federal level and the state level to try and get investment in making sure that childcare is affordable for everyone and that it pays a living wage to the people who are doing the work, the mostly Black and brown women out in our communities doing that work. So those are just a couple of examples of sort of what I would say are some of the bigger, like not bigger, I don't mean bigger and not more important, but just the 10,000 feet as opposed to 1,000 feet, things that we can be doing both at the same time.
One question about an update on the, I believe the New York City DO8 Department of Health and Mental Hygiene expanding their 3-visit program.
You know, I'm unaware of it. I'm sorry, I'm unaware of that DOHMH initiative.
Could you put your website in the link and that home visiting opportunity in the link? I would definitely apply to it. But that is something as an advocate that is a way for a person to get in on the ground floor and begin to make those changes to, as you spoke to earlier. Thank you.
So at the moment, while Kate's typing in that info in the chat, I don't see any questions written here. So I invite folks, if you have any last minute thoughts or questions, to just unmute and go ahead and.
Hi, this is Ray Lopez. I'd like to share a little bit. So I am Director of Programs at Little Sisters of the Assumption Family Health Service, a CBO in East Harlem, New York City. And we've been grappling with this issue for a very long time, of figuring out how to get our, what essentially have been social determinant of health services for decades, although we didn't use that terminology decades ago. And just figuring out how to unlock another revenue stream, maybe through the health system. And so we thought that DSRIP and that whole project would begin to unlock that for community-based organizations, hospital systems organized with provider networks to reduce ER visits and hospitalizations. But unfortunately, those partners that sort of stuck together were the largest ones, the ones that provided the most service to the most people. And CBOs, like probably many here, provide more intensive services to less people. But we remain engaged there, and we are part of Mount Sinai Health Systems, sort of their post-DSRIP project, which is sort of create an umbrella organization to get CBOs together and then maybe work on an SDH project and finally sort of unlock this ability to bill for CBOs. So, for those looking for ways to get in, maybe, look for your performance provider network, that existed during the DSRIP years. And maybe they are working on something similar to Mount Sinai where they can engage CBOs in this way. Share that as a start.
Thank you, Ray. And yeah, I think, the kind of now ended DSRIP, or in most places it's ended, the funding has ended from the state, did provide some opportunities. And I think, to your point, it was often some of the larger community-based organizations that were better positioned to engage. It speaks to, I think, the importance of relationships in your community, right? Because if Mount Sinai knows you, they're gonna go to you. And also thinking about, how do I explain my value to a hospital administrator in terms that will prove to them my value, that are around health outcomes and stuff like that. And I think the health system isn't the only place. I have these discussions like with, folks at the policy level, but the health system is better resourced than our human services system. I mean, there's some really good books and data about that, how, our nation spends a lot more on health than other nations and doesn't get better outcomes, but other nations spend a lot more on social services. And so I think that the health system should be among the places all of us who care about social determinants of health are looking for reasons. Not the only place, but I agree, we should be looking there. And and that also reminds me that I think part of the challenge there was the way that DSRIP was structured. Was it really, there wasn't a lot of incentive to help kids and families just because of the way it was structured. So I will note that the state is applying for a next round. They're not calling it DSRIP 2.0, but they're applying for a whole new waiver to bring in money. And there are a group of us who care about kids and families who are trying to influence it in a way so that there are incentives for our systems to resource children and families.
This is a great presentation. Thank you so much. I'm Aaron Miller, a pediatrician at New York City Health and Hospitals in Central Office. in charge of child abuse prevention and treatment across our system, which is a brand new position. And I want to flood our system with positive parenting classes, either on site or closer to the community. And we use NowPow, and I want to get all the organizations to be close the loop, which is not going to be easy. So we can do weekly case tracking and see how many went. So we could do follow-up phone calls. So like you were preaching to the choir, and I appreciate your understanding of all the issues. So I'm ready to get going. When you say that, I read in the chat box, New York City is a pilot site. Is that for the 3-visit model? And if so, who's delivering that? I know DOH, MH delivers that, but I'm familiar with Power of Two. I met their executive director. They're a great program. I want to do more referrals to them. Nurse Family Partnership only has 5% uptake of eligible mothers. So when you say New York City is a pilot, who's involved in the pilot?
So actually, I can't remember there are a few pilot sites, and I think the person in the chat was referring to something else that was New York City DOH-MH, and I was referring to something that was New York State Department of Health. But I will say, if you're looking at different programs on our website, which I put in the chat, on our home visiting section of our website, we have a grid that shows different programs in New York State, different evidence-based or evidence-informed programs in New York State. It's a little old, it's a little couple years old, out of date, but it's sort of a menu, because home visiting is confusing. Those of us who know it kind of know it, but if you try and talk to a policymaker, most of them don't know what it is. Or they know one program, and it's really kind of confusing. It's not a system, right? It's a bunch of, at the moment anyway, in New York State, it's a bunch of programs. So Aaron, to your question, one, I can try and get some other information, and I'm happy for anybody to email me if you want specifics about those MICI pilots, Maternal Infant Care Initiative pilots. But then also feel free to check out the home visiting section of our website for sort of other stuff.
So I'm Corrine Laurie Maben from Andrus, where we, as Ray had mentioned, this is some work that we've been doing for many years and not necessarily calling it social determinants of health. I think the area that I'm more interested about is, what you had mentioned around if we're screening. So we were screening for social determinants of health in our Article 31 clinics as part of DISRIP. And going to the fact where if we're screening and we're not able to respond or provide a referral, as you stated, it creates more harm. So for us, as we continue to look at ways of how we're responding to the social determinants of health, I'm curious as to what are your recommendations around responding to the experience of racism and discrimination that the families are going through? And there's not necessarily a referral for that, but what are some of the programs doing? Like, so if we screen that, how are we responding to that as an organization?
Thank you for that question. I don't know.
So I was thinking maybe someone here may have.
Yeah,
we're trying to figure it out.
Please.
Trying to figure it out. So I figured I'd ask the question and
yeah,
see who's doing what, and maybe something we can learn from them. Yeah.
I'm going to jump in because this is part of my passion in trying to help parents be the first teachers to their children, especially from low income and disenfranchised communities. So when I say I try and get the faith-based involved, because that's a neutral ground. Parents don't trust the Department of Education, but by law, they do have to have parent associations. They work with after-school providers. They work with the hospitals already. So I was thinking there could be an approach where first, the state only sees one school district, and in New York alone, there are 32 school districts. So how do we strategically balance that out? I'm a student of Mega Evers. I graduated with my BA in public administration. So I'm trying to think, how do we take this So every child belongs to a school system. So PAs are mandated to be in place. So why not strategize on the community educational level, your community board level, and see how we can make a closer connection from the needs of the parents to the resources that are available, because most people don't even know in low-income communities that they can go to their community school board and have those conversations on the local level. So then you begin with your civic engagement and all the other things that we learned today. So I'm just thinking out loud, and I'll be quiet.
I think you helped me with part of the answer, which is the civic engagement pieces.
Yeah.
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 And the churches could do that.
Thank you.
You're welcome.
I also wanted to elevate, someone wrote in the chat, just in terms of trauma-informed approaches and applying principles of social determinants of health. The film Resilience is a fantastic tool, and Prevent Child Abuse New York has a program team and a training team that screens resilience and facilitates kind of a training and discussion. So if you're interested in that, please send me an email and I can put you in touch with those folks there. Closing thoughts or final remarks as we wrap up. Again, thank you very much. We truly appreciate your patience as we kind of navigated the technical difficulties of our Zoom age. But again, I invite you to send me an email and I will be in touch with follow-up information. This session is recorded, including the really wonderful and rich conversation that happened at the end where folks were sharing resources and thoughts and ideas. And all of those live on our Home Visiting Coordination Initiative website under the webinars section. You can go ahead and reference that as well for our previous webinars and a list of upcoming offerings as well. And we apologize for the capacity issues, but I suppose that is a good thing that we've had so many people trying to join. So we can just learn for next time that we'll put it on an account that can accommodate more.
I wonder if I could just share something about a program in our community that might be inspiring, or, you know, I mean, if you don't have this in your community, just thinking about organizing something like it. But it's we're in Tompkins County in central New York, and we have an organization that's called the Village at Ithaca, and there's, you know, they're like their kind of slogan is, it takes a whole village to raise, educate, affirm, and inspire a child. And their mission is to advocate for the educational equity and excellence for all students, especially Black and African American, Hispanic, Latino, Latinx, and low income or any other underserved students within our county through strategic community relationships, assessment of the local school district's practices and policies, and responsive programming and services. And some of the support services that they provide are academic tutoring, ongoing food and household support, student success mentorship. They have a village emergency fund, family advocacy program, and youth identity groups. So they are targeting populations who are historically either underserved or who have experienced inequity in the systemic inequity, and they have all these support services and programming, and I think they're also a pretty strong link to other community support services. So I think that's, you know, one way a community is addressing some of those systems. And I know also we have a youth farm project in Tompkins County that is encouraging youth, again, from an equity standpoint, particularly Black and Hispanic, Latinx next and low-income kids to get involved in learning how to grow food and market food, sell food, prepare food, share healthy and nutritious foods with their communities. And so, you know, kind of starting young and getting folks involved in things that are traditionally have not been really inclusive, and bringing that to, you know, their friends and families and communities.
Thank you very much for sharing that. I think that's one of the beautiful things about the Home Visiting Coordination Initiative, or HVCI, is that you're able to hop on and talk about some really great work that's happening in your community, and then other folks from maybe across the state can hear and listen in and take notes and get inspiration. So thank you very much for sharing. So we are a couple minutes past the hour, and again, I do appreciate everybody kind of hanging on. Kate did have to jump because we're in the world of Zoom, where we go from one meeting to the next with absolutely no time in between. But appreciate all of you folks joining us today and partaking in the conversation. I will be in touch with follow-up resources. Thank you very much. Have a great day, everyone.